Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlan Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. Hey gang, welcome back. Another exciting episode of the Health and Wealth Power Hour. I am your host, Harlan Pickett. It is such a joy that you join with us today. We've got some exciting stuff for you. I'm sure you're going to have a great time. We're going to dive into all kinds of crazy stuff today, just like usual. We are super blessed today to have Dr. Ravi Iyer with us. He has got insights in all types of situations and things around the world. He is a well-known worldwide speaker, much sought after podcast guest, and we are super blessed to have him with us today. Doc, welcome aboard, buddy.
Thank you, Harlan. It's a pleasure to come on board and talk with you today.
Yes, sir. Absolutely. So I have to ask a question that is more of a general question. And that is, how did you head down the pathway to become a speaker? And I ask that because I'm that way too. I go out and I speak at a number of different places, not just on the podcast, but I go out and speak in public. It's not for everybody. I'm sure that you've seen that too. You've come across folks. But what made you want to be a speaker, and what has made you successful as a speaker?
So growing up in India in my high school, we were blessed and very fortunate in getting public speaking training.
Awesome.
So in my school, we used to have elocution contests, and students in 11th and 12th grade were encouraged to participate. They could pick a piece, usually would pick a piece from some novel or literature. I remember I picked up the piece A Stone for Danny Fisher from Harold Robinson's book, A Stone for Danny Fisher. In the end, there is a piece where he's writing about picking up a stone and placing it on his father's grave, a man he had never known. And I talk about that. I basically, so we memorized the passage and then we would deliver it before the whole school. So, and we had coaching. We were coached on voice modulation, speaking, posture, eye contact, segmenting of the crowd, all of those techniques that speakers use. I was fortunate in getting that training as a high school student.
That's awesome.
And then after that, the business of getting trained as a physician took over, and I really did not use those skills as a speaker, except when I used to present at medical society meetings on some research topic or something like that. So those were much more selected. During the pandemic, we became very successful in combating the divisive rhetoric that was dominating public conversation. Because one of the things that we became early on, we realized that the real problem in the pandemic was not the virus, it was the fear of mortality that was the real contagion. And this fear was being driven by a conversation that was very chaotic, where the leaders were not able to communicate a clear action plan with confidence without conflicting with each other. even in the various briefings, you would have one person talk about one aspect of what they're going to do, and that would be contradicted in the same meeting by somebody else. And it would be very chaotic, and it was very, very demoralizing for the American population. So, as a physician, my, we have we were running a COVID testing and treatment center, and I would get patients coming with all kinds of conflicted information that I would have to winnow out, and I would have to redirect and re-educate. So as I started doing that, I started comprehending this entire divisive rhetoric was based on a particular worldview which was limited to uh, a tribal kind of view that you are either part of me or you're not, and if you're not, then you are to be feared and to or to be opposed or attacked. And the and for me, I recognized early on that if we were to survive this pandemic, we can't be fighting among each other. We have to embrace and create community. And to do that, I was able to do that one-on-one with my patients. But then as the pandemic waned away and we started coming out of the pandemic, I realized that much of the devastation of the pandemic was totally unnecessary, that we could have done a much better job across not only in the US, but all over the world. And I felt that I needed to take the lessons of my clinic out into the public. And I decided that the work I've been doing one on one, one patient at a time, I need to do it one to many. And that's when I started saying, okay, I'm going to draw my high school training in speaking, bring that out, and start communicating this message of how do you get across this idea of this us versus them. I call it the us versus them. I also call it the poverty mindset. And it all comes out of a particular worldview, which is very restrictive in the options it gives you.
Yeah, because we talked a little bit before we started recording, and it was very, very pronounced during the pandemic. You're right. The us versus them was very, very pronounced. There were clear divisions in what people's mindset was on certain things. And they could have the exact same mindset on one little piece of it. But if you were different on one little other part, then all of a sudden you were them, right? It didn't matter that you agreed
Yeah,
with me about everything else. If there was one thing you didn't
yeah,
agree with about, then you were them. And it was very, very pronounced. So that's very astute for you to have looked at it that way. But as a society, I think that goes across everything, right? I mean, we're such a conflicted society that it's almost like we're looking for a them, right? It's almost we want someone to argue with or whatever. Is that just part of our human nature, Doc?
yes, it is. It is hardwired in us. And it comes out of, it is actually evolutionary. It comes out of uh, a, a sense of the way we approach reality. Let me take one little step to the side and talk about something that is very fundamental. Right now, I'm speaking and you are listening to me. But what you are listening to is not just my words. You are also listening to a voice inside you that is telling you about what I am saying. It is constantly interpreting my words in a language that you understand, and it's fitting my words into a framework that you have already gotten from your past experiences. So you don't really listen to me as I'm speaking. You're listening to me through the filter of your
With a
past
filter.
experiences.
Right.
So that filter is your narrative. It is your narrative lens. And it is not the same as reality. Reality, Harlan, is molecules hitting my eye, giving me images. Molecules wafting up my nose and giving me scent. Molecules striking my tongue and giving me taste, wind hitting my ear and giving me sound, molecules hitting my skin and giving me touch. That is reality. But what we do is we take those impacts, we take those physical and chemical impacts upon our body, and we make a construct out of it. We make a narrative, a story, a judgment, an interpretation, a conclusion, an inference, an assumption. All these are your constructs. These constructs literally are the world you live in. Example, that at the time of Christopher Columbus, the major conversation, the major construct was that the world was flat. And it was flat, and that was the way the entire Western world conducted its naval and trade operations. So the construct world is flat determined how you lived your life in those times. And you can then take that same example to every other thing that you do in modern day. You have a construct, and there are people who take these constructs and they are not able to see it as a construct. They see it as this is it, this is real.
This is the reality.
And so here's the problem. These constructs are created to protect us from the unpredictability of life. I'll go one step deeper. When my caveman and your caveman ancestors were walking the woods of Jurassic Park, and let's say that my ancestor back in the caveman age happened to come face to face with T-Rex. And T-Rex is there and he's going to become a meal for T-Rex, and somehow my ancestor managed to escape that one encounter. From that moment onwards, he has a construct, and the construct is when the ground shakes and the trees shake, run. He is never again going to face the reality of actually coming face to face with T-Rex. He's going to take this construct, ground shaking, tree shaking, run, as T-Rex for him. That becomes T-Rex for him. That is how we live. We create constructs because life is unpredictable, and as a result, we all are trying to figure out what's likely to happen in the next 5 minutes so that we can position ourselves to either maximize our pleasure or minimize our pain. That's all. And because of that, we are all creatures do this. The tiger that cannot figure out where the deer is going to appear is going to go hungry. The deer that cannot figure out where the tiger is going to appear is going to get eaten. So this is real. It is real important to have these constructs. But when it's one thing to have constructs, it's another thing when the constructs have you. The problem becomes when you don't see these things as constructs, but you make the mistake as this is reality. Constructs are only an approximate representation of reality. They are not an accurate representation of reality. And it is this fundamental dichotomy or this fundamental blindness that pushes you into every negative response you have. The us versus them, the idea that somehow the resources that are important to you are limited in availability. During the pandemic, everyone was behaving as if the resources that were critical for their survival was not available to them forever. That if they don't grab at it now, it'll go. It'll go away. They will never get the opportunity to get it again. And that's a construct. The construct is resources are objects in time and space for me to consume. But they don't have the construct that I am the creator of resources. They only see the construct as I am the consumer of resources. And whereas there are a few people during the pandemic who felt that I am not consumer, I am actually the creator of resources. And for those people, they had they had a phenomenal amount of flexibility. They could move and pivot and manipulate circumstances to work for themselves. And they succeeded like nobody's business. They managed to keep their businesses open. They imagine for 22 months, Harlan, theirs was imagine being the only business in town and every other business is shut down. How profitable is that for you?
Yeah.
That was us. That was us. My clinic was profitable, whereas every other clinic closed because the rest of the doctors had a construct that they did not feel that they could actually manage their life. We had a construct that we can keep ourselves safe and continue to keep delivering care. So each of these constructs actually determine whether you live or die, whether you flourish or perish. And that is the essence.
Okay, so I'm not going to argue with you at all on that. There is no way I could ever deny that we don't have our own filters, right? Our experience have made our filters, whatever those are, and good, bad, indifferent. It doesn't matter, but they're there. So, Dr. Iyer, how can you, if you know that you have kind of, let's say you're kind of closed-minded, and you know you're a little closed-minded, and you say, "Hey, I really would like to work on this." What can you do? What can you do to help? You may not ever be the most open-minded person in the world, but what can you do to help that? One of the things that I thought about as I was listening to you is working more diligently to be an active listener, to listen, not to respond, but to listen to understand. Because I think most of us, what we want to do is we want to interrupt someone before they're even done because I already have the answer. I don't even need, you don't even need to talk anymore. Just hush right there. Let me tell you what the answer is. And that's just listening to respond. We may not even know what you're really saying, but we've already made up our minds because our construct has told us that's what you're going to say, right?
That's right. Go ahead.
No,
You
I'm
are
just,
you
I'm thinking out loud
you're
here.
I'm amazed that you struck it right there.
Hey, the blind squirrel finds a nut every once in a while there, Doc. You know, I just, it to me, that's, I think that's kind of what makes sense to me is that if I would spend more time listening in the cases where I think I've kind of got a small minded set, if I'd spend more time listening, then I think maybe I would have a better chance of understanding.
So here's the thing that you struck the nail on the head when you said listening. To listen requires yourself to be internally silent. Because if you are internally cacophonic, if your mind is racing and there is that internal voice going on at if that is screaming, that is going to drown out the input that is coming to you. There all through the centuries, in diverse cultures, in diverse theological and spiritual, they have different strategies to be able to develop the ability to what I call active listening. Active listening requires you to be internally silent. That it requires you to have a certain calmness within and a sense of identity that is grounded in something that is greater than the narratives that are popping up all the time. Our awareness has two aspects. Our consciousness, the one is the ability to perceive, and the other is the ability to create these narratives or constructs out of our perception. To separate these two functions requires you to be internally silent and anchor yourself on just the perception and to work hard. You actually have to work hard at suspending these judgments and interpretations. And the only way to do that is to see the objects that's coming at you and be willing to experience it without trying to put it into a labeled box. Uh, the children do that all the time. For them, what they do is they see a stick on the ground and it's wonderful. You know why? Because that stick can be a sword, it can be a spear, it can be a lance. It is so many different, so all those different possibilities fill a child with joy. And the reason the child is able to see the possibilities in something as simple as a stick is because it has not yet built up its library of stories, its library of constructs. And therefore, it is willing to use the stick and use it in any different way. Then somewhere along the way, the child suddenly decides, look, this stick is a sword. And from that point onwards, all the sticks become only swords. All the other possibilities die out. Our constructs give us the safety of definition and surety at the price of being alive, at the price of our own internal freedom, at the price of giving us options. So when you have a definition, when you have an answer, you have no more options. See, it is far more powerful to be able to remain in a question rather than grabbing at an answer. And then, you know what you can do if you're really good at being in a question? You can decide which answer you want to play with today. You can see
Right.
all the answers. You'll see all the different possibilities and say, okay, today I'm going to use this possibility as the guiding narrative for this scenario today. Tomorrow I will dump it. I'll use some others. And that's how I live. I live from a state of grounded awareness. And for me, the narratives that pop up are just options. And it's an position of immense lightness of being and immense freedom. And it is, then life becomes fun. A pandemic becomes just another exercise of riding the rapids.
But how realistic is that for most people? And let's just talk about the reality of that, right? The reality of that is the pressures that society put on us from every different direction, whether it's our family or just where we live, the culture that we live in, our work environment, all of the things that the world bring on us. Doc, how many people really have the option to do that? I mean, I think it's a
Not
valid question. Maybe I'm wrong, but I
uh,
think it's a valid question.
no, no, it's a very valid question. The valid question is the question, if I were to put it in a different way, is how realistic is it for all of us to become Michael Jordan or Kobe Bryant? The answer is no. There are not too many Michael Jordans and Kobe Bryants in the world. And Kobe Bryant, rest his soul. But there are, but that is the peak of accomplishment. You don't have to reap the rewards only at the peak.
Right.
Even if you are able to do this exercise of trying to shut down your internal chatter for 5 minutes in a day, when you get up in the morning, anybody can do this. When you first, the first thing that, my father said this to me, he said that, you know what is the most difficult thing to be good? The most difficult thing to be good is when you try to be good, the most difficult thing is to tell your people who's hosting you at a party that you have to go to bed early and you want to leave. You know why that is important? Because if you're staying up late, then you won't be able to get up early in the morning. If you don't get up early in the morning, you can't, you're already behind the eight ball getting ready for work, and then you are rushing, and then you're rushing for work, and then you're in a hurry, and everything else starts falling apart. By just all you have to do is you have to go to bed early, and then you can get up at 4:30 in the morning and give yourself 1 hour of time. All right. Let's say you have to be at work at 7, and I get up at I for years I have gotten up at 4:30. But you know what I actually do between 4:30 and 6:30 is my time. Because the rest of my day, my life is given away to other people. Other
Gotcha.
people have my time. They are saying, Doc, I need your help here. I need your help there. So there is no such thing as my time. For me, that little time that I get every day is my time to do. If I spend that 1 hour picking my nose, that's fine. It's my nose and my time. So, so but it is intensely important to have your time. And people need to learn to give themselves that time. And I spend my 5 minutes doing something, something towards calming that internal chatter, whether it is just watching my breath, or I have a habit of taking a piece of paper. I have a book, and I will write a word 3 times and then go down the road. Like, I'll do that 108 times, the same word. All right. The act of writing that same word 108 times silences your inner chatter. All right. The Gregorian monks had a chant, and they would do the chant for 10 minutes. Some people may have a rosary, and you do the rosary. It doesn't matter. All of this is only one thing. It is developing your ability to develop internal silence. And when you have internal silence, you actually have freedom. And then you can look at life as it approaches you, and you can pick and choose which storm you want to let in. Because I call this the sensory cyclone. This narrative spinning around us is a sensory cyclone. Grounded in the middle is the eye of my awareness. And if I can find that eye and I can stand there, I can watch the sensory cyclone, and I can choose which I want, which whirling wind I can play with.
So this time that you spend, this quiet time, this time working to silence that inner voice, that helps you then expand, right? It helps you expand your filter, as it were. Maybe clean out your filter is a better way. It helps you clean out that filter.
Yeah, yeah,
So that you can approach your day with a cleaner filter. Yeah. Obviously, it's never going to be spotless. It's never going to be that newborn child, right? That young child filter. You're never going to have the same joy with a stick the very first time that when you're a kid, and it can be anything. No matter how hard we try, we've still got our life experiences are going to have something's going to go there. But that helps you set your mind right for that day.
yes. And then, well, so you just hit upon what happens in the beginning. When you begin this process of giving yourself 5 minutes, 10 minutes, 15, 20, 30 minutes of this quiet time, you first clean out and develop that inner silence and grounding. Later, when you become skilled at it, and what you do in that quiet time continues to percolate through the rest of your day. You walk through your day, and you will notice that that inner silence doesn't disappear. It stays there like a background note, like a harmonic that is there at the back of your mind, which, and later, even later, as you develop more and more skill, it becomes a sanctuary that you can retreat at will in the midst of your day. You can go into your quiet time at will. Then, so I gave you the 3 stages of development. The fourth stage, what happens is you develop so much skill that you can remain in the silence as you're dealing and interacting with people. And then something very interesting starts developing. People start coming to you with their storms, and they find that when they come in your presence, their storms become quiet. You carry this aura of calmness around you, and they experience it and they resonate. Human beings are not just isolated. We respond to each other silently. When when you are calm, the first people around you will become calm automatically by a factor of resonance. That resonance gives them options. And then you know what happens? Your presence becomes attractive and sought after by other people because they find options for them when they are in your presence. They don't understand why, but they say, you know what? I feel good around this guy. When I come to him, I see things more clearly. Somehow I don't feel as anxious. I don't feel people will start. This is how leaders are born. A leader is someone who is able to shift your narrative and give you options. Leadership is entirely about approaching life from a state of grounded awareness and inner silence that allows for options to reveal themselves. That is all there is. And when that happens, what happens is that people say, you know what will you do, Doc? They come and ask me, tell me what can we do? Having this ability was immensely powerful during the pandemic because I and then in and then your communication goes to a different level because when you speak by your inner silence, they are internally a little bit more silent, and therefore they are able to listen to you. And your ability to influence their thought process or to persuade them to see the options that are possible for them become more powerful. So this 5 minutes, and I know that people have written about it. They have called it the hour of power, and it is truly powerful because it generates a resonance that carries you through not just your day, it carries you through life.
So, what's the difference in your mind then? A leader that is more quiet, calm in the storm, than the one that is bolsterous out there telling everyone, the way it is. And in other words, they are the storm to a certain degree because there's obviously leaders out there that they are a storm, right? They just everything, it revolves around them because they are the eye of a storm. They're just, that's the way their personalities are so strong. They draw people to them kind of in the opposite, right? In the opposite way. Unfortunately, we've seen bad people that way too, right? We've certainly seen world
Yeah.
leaders and people in
So
history
what
that have been the other way as well, not just listening. Obviously, it would make a whole lot more sense to be better for everyone if you had the listener and the person that calmed the storm. But let's talk about the other side of it as well, too, and some of the negatives of that.
so the difference between a leadership and chaos are two different things.
Sure.
There's a lot of power in chaos. I'm not saying that the chaos doesn't have power. What chaos doesn't have is coherence. It doesn't have it doesn't have harmony in that power. So a lot of that power, you can have immense power that is uncontrolled and wasted, but is still vastly overpowering and destructive just because of the massiveness of that power. So, so you can have something like a huge fire and you can have a laser. All right. A laser will cut through everything. There is no chaos in a laser, but it is intense, focused, and powerful. So no matter what you take, any leader who's capable of focused, directive, controlled power, they will still cut through nonsense and win the day over time. You can have someone who's chaotic and overwhelms you by brute power, but if they are not focused, I can tell you they will never last long enough, and it is only a matter of time before a laser cuts them through. So I don't have much to say there. I mean, to me, it's a no-brainer to develop. See, the other thing is being internally silent is not passive. Is not being passive. Internally silent people can be tremendously active and powerful, but there is no wasted effort in their action. There is no distraction. There is no disharmony. There is no dissipation of effort. It is like looking at a gorilla uh, attacking versus a lion. That is completely different. A gorilla will rush and throw sticks and stones and do all and overwhelm opponent by sheer power. A lion, there is no wasted effort in the lion. When the lion moves, the lion doesn't go around posturing. It won't posture. It'll remain silent, and then suddenly it'll move without giving any indication that it's going to attack, and then the game is over when it attacks. So that's what I'm trying to say. There is no posturing for a true leader.
No, I think that is a very valid statement. There is no posturing in a true leader. I think that is very, very well said, sir, because I think a lot of times that's all it is, right? In some leadership, all they have is posturing, right? There's really no substance there in many cases. It is
It's,
a very much like
it's
a
like the
force
Wizard
of
of Oz.
personality, right? It's a force of personality, but there's no actual substance to it. I like what you said there. It's a fire because that fire may burn hot, but it's going to go out. But a laser is eminently more powerful and is going to sustain much longer than that fire is, and it's going to be much more precise and take care of business, as it were.
Yes, that's right. That's right. Yeah, that's right. Examples for me are people like JFK and Martin Luther King, and when these people moved, they moved. I mean, they shifted the narrative. The narrative in Dr. King's life was of disempowerment. That there was not enough options available for freedom and choice. And he came out there and in front of Lincoln Memorial saying, "I had a dream. I have a dream," and he shifts the narrative for thousands of people sitting there, and they all were able to experience the same dream right there. I have a dream. And
Yeah.
so that is what I saw, that it is important for people to recognize that they are not the victim of their circumstances. They are actually the creators. And because even the circumstances, their narratives, they are the creators of those narratives. It's just that they don't see them as creators. Don't see themselves as creators. They think that, oh, this narrative is just hitting them, but they don't see that they created it. They can create something else.
Yeah, I think that's our victim mentality, though, right? I'm in this circumstance, and woe is me. There's nothing I can do about it. And once again, I think we go back to human nature sometimes that we want to blame someone else for our circumstances and not take ownership of those, and knowing that our mindset could change, and just a change in mindset could change your circumstance.
The desire to be safe, the desire to not have to struggle, is universal. But the if people recognize that they, for the want of just a little bit of effort on their part, they are actually trading away huge segments of their freedom, they will suddenly realize the cost of safety. There is there's a huge cost of what I call cheap safety. There is something that is really valuable safety, but there is also a cheap safety. And the cheap safety is a fool's errand. It tricks you into the illusion that you are better off, whereas it actually imprisons.
Yeah, I think that's very well said as well. Now, I did want to point out to the listeners that you have a book out there that really covered that era of COVID. Love the name, The Reaper's Dance, and
Yes,
it talks about 1,000 days of COVID. So I'm
I
sure
have
that
it here.
all right, great, great, great.
Yeah.
Uh, so I'm sure that some of what we've talked about already is part of that book, but give us a little more insight onto this book because just reading about what the book sounds to be about is pretty daggum intriguing.
So the book has three sections. One is the the impact of the pandemic on ordinary people. The second part was the second aspect of it was why did we struggle so much with this particular crisis? What were the factors that made it so difficult for us to get our act together? Why could we not do a better job than what we did? Um, and then the the third question was, uh, why did the pandemic have to happen? Why now? Why did we have to experience this kind of a pandemic? This was this really inevitable, or was it some parts of it? Was it possible that we may have accidentally unleashed the dragon ourselves? Um, and The fourth question was actually, what can we do? How do we make sure that we don't have to go through this again? Um, and so those are the things. But the real important aspect that I felt that was one of my catalysts for driving forward into speaking publicly about this is that think about the nuclear war. The Think about Hiroshima and Nagasaki. Two bombs were exploded, and 250,000 people died. And th- th- that 250,000 deaths created the nuclear armament treaties, the Atomic Energy Commission, and all the guardrails that controls nuclear activity worldwide. Um, that With real enforcement capabilities. This pandemic killed, by some estimates, about 10 million or 15 million, and some estimates up to 25 million dead. And we still don't have any um, real guardrails that governs the conduct of viral research, pandemic capable viral research. There is now significant evidence that has accumulated that strongly points to the hands of uh, both US as well as Chinese scientists and regulatory authorities failures in actions that they did in certain research labs that may have led to the creation of the pandemic itself. And While there was no idea that this is actually an intentional release, there is now significant information out there that points that this was probably an accidental lab mishap. And we still don't have guardrails. And even now, the universities in this country, there are 35 BSL-4, BSL-3 and BSL-4 labs in this country alone. And because of the pandemic, there's been a surge in construction of high containment labs all over the world.
Yeah, it is interesting, right? We've learned since then, and still what we haven't learned. I think that's just as interesting is the things that haven't kind of been talked about or haven't been brought to light or haven't been shared. However you want to look at it, it's far enough kind of behind us now that you think that there would be more of a curtain pulled back, but there hasn't. It's slowly trickling out a little bit
Yeah.
by a little bit.
Yeah.
Now, as far as okay, so let's kind of put that part of the pandemic aside just for a second and talk about kind of the response. Because I know one of the things we talked about earlier too was the kind of the overall response of the United States government to it, and leaders in particular not really doing a good job leading because no one knew anything, right? We just didn't. You had one in one single meeting about you would have different people in that meeting talk about different things, right? Contradict each other. So, in your kind of overall look at this, did other countries have these issues as well? Was this a worldwide, was this a human problem? Was this a humanity problem? Or what did we see something different here than what may have been happening in other places?
There were a few countries that really got their act together very well. But for the most part, a lot of countries struggled to put public good ahead of personal interest. Every country's politicians were more interested in protecting their power, protecting their election, protecting their the narrative that they were the best and the good, rather than truly mobilizing the resources of their country to on a war footing to protect people. There was an analysis of Canada versus United States there, and they said that for the year 2020, the US had 200,000 more deaths than Canada. So here are two countries sharing the same space with relatively similar first world economies. And one country has 200,000 less deaths, and the other country has 200,000 more. And I remember a conversation with a doctor friend, and he said that when you kill one man, they hang you for murder. When you kill 200,000, they call it bad policy.
Oh my gosh. Yeah. Yeah. There you go. You're exactly right. So, do you think any of this response that they just didn't believe it was as serious as it was? When we were first told what it was like 2 weeks, right? In a couple of weeks, this is going to be over and everything will be back to normal. And it stretched out, but it seemed like it took a long time for it to really sink in to everyone that this was going to be a longer term ordeal.
Let me dissect this out. January 2020, White House officials knew that this was an airborne virus. NIH officials knew that this was potentially a lab leak. NIH officials did not want their hand in the potential culpability of that to be leaked. White House did not want the economy to tank on an election year. So both of them put those interests ahead of coming out and saying, hey, this is a virus. We already know that this is the nature of this virus. It's a respiratory virus. It's going to come out, and this is how it's going to spread. We are going to do these things. They were more interested, the NIH officials were more interested in January, February, and March and April. For 4 months, they were more interested in tamping down conversations about lab leak. White House in January, February, March, April, May were more interested in tamping down the seriousness of this. They were talking about how by Easter, everyone, it's going to be a beautiful Easter. Everyone
Right.
is going to be having a great time. You'll have today there are 12 people. By Easter, it's going to be all gone away. It'll be miraculously go away. It'll be an Easter miracle. These were the words being used. All right, and people were dropping like flies all around, and that was the story. So here's the thing: this is what is happening when you have people fixated on one picture
Yeah.
rather than when they're self-preservatory and narratives. You know, the constructs that I talked about, they're all about preservation. They're all about self-preservation. They're all about running away from T-Rex.
Yeah. Yeah, that's right.
Right? It is not about, okay, I have T-Rex and I cannot run and I'm going to be able to. It is all. So that is what happened. The pandemic was a T-Rex coming at you.
But at the time, they didn't even know what it was. They didn't know it was a T-Rex. The ground was moving. They weren't sure it was going to be okay. They knew it was a dinosaur. They just didn't
Yeah,
know what kind, right? They didn't know what kind because they had also seen the ground shake and they looked over and they saw this one eating a tree. So they weren't scared of
yeah,
that one eating a tree, but they didn't know which one. But all they knew for sure was I need to protect myself, whatever
that's
that
right.
looks like, right? Whatever that
And
feels
that
like.
was the us versus them. So they
Yeah.
wanted to protect themselves first, and their vision of us was only people who looked, spoke, and talked like them. So, here's the thing. So if you start now dividing, how many us's were there? There was uh, an NIH academic institutional us. There was a White House administration us, and everyone who supported that us. And then there were, and lost among this was the common American
Yeah.
mom, pop, dad, grandpa, grandma. And we, in the healthcare workers, we were left to take care of all this them. And we were left with very few resources to take care of them, while all the us's were protecting their behinds.
Well, and from my view, as obviously I'm not a clinician, but as my involvement with a lot of healthcare people is there. What I saw also is because of so much of us's, like you just described them, that all of a sudden a lot of that filtered down into the clinician world as well, that all of a sudden it was politicized in many different ways, and doctors
Yeah,
became part of this whole thing because
yeah,
whether they wanted to or not, they become pawns in this game in many cases. And then there was
yes.
even battles between clinicians and
So,
hospital
so,
systems, nurses, and all of this. It was terrible.
so here's the thing, right? Harlan, let's say you get a cut, a bad cut, dirty cut. It's got some soil. Now, the proper treatment is to clean the wound. So you wash it with saline, you wash it with a little bit of iodine. But then, if you leave the cut open, you can still get infected and die. So the next step would be to suture it, and to close the wound and to bandage it and then keep it clean. And the third step would be to give antibiotics. So, like that, you would not stitch up a dirty wound, you would clean it. So, there were some medications that are not effective, completely heal the wound, but would be like washing and cleaning the wound. So, for example, hydroxychloroquine. Hydroxychloroquine is not a zero, completely useless drug. It did have some mild effect. If it was given early on, it would reduce your threshold for getting sick, but not completely. But what they did was they used the index that the medicine that you're giving has to cure you. Well, hydroxychloroquine will not cure you. But to say, so hydroxychloroquine was like washing the wound. But to say that washing the wound is useless is also not true. So they dealt with half truths and therefore painted everything as no. If you are saying hydroxychloroquine is poor, then you are a quack. No, it is not so. So obviously, the people who are being called a quack will rise up and say, hey, you guys have an agenda. You want to make billions of dollars with your drugs. And therefore, you are coming out against something that is cost a few cents. And so suddenly you created a new us versus them camp.
A new one, right?
You
Yeah,
know?
yeah.
So this is how the dynamics of all of this was evolving. Now, on the ground level, we doctors on the ground were seeing that, hey, there was some value here, there of something. And we adapted to use multiple lines simultaneously. And our patients benefited. To a large degree, we kept that outside the radar and we kept it, did our things that we needed to do to protect our patients, whichever way. I used Paxlovid, I used vaccines, and I promise you that I have also, in the first part, we did a large number of physicians, almost 50% of physicians in March, April, May, and June did give hydroxychloroquine, not just in the US, all over the world. All over the world. There were agencies that gave in Africa, in India, hydroxychloroquine was widely used.
Yeah, but we don't hear that, right? We don't hear that because that's not what they want us to hear.
No, because no, I'm not saying that it was not a miracle drug,
No,
and
I'm not saying it was, right?
it wasn't, but it was not completely useless also. And so people were, there was a lot of institutional dread. There was a lot of institutional disinformation and misinformation
Yeah.
being said.
And I know it is certainly caused a rift between clinicians and patients. There was certainly a loss of trust there because of people seeing doctors fighting over something and there being no consensus there. I think it was one of those strangest things that us as patients have ever gone through, seeing this strife between people that we've kind of always looked up to and said, these are the people who are going to take care of us. And now if you look at the guy on this side of the street, he believes this, and the guy on this side of the street believes this. And I don't know which one's right because both of them are well-educated physicians. And
Yeah,
I'm sitting here and I don't know anything that WebMD don't tell me. And so now I don't even know what to do. Right.
correct.
I've got to
That's
look
right.
at it through
That's
my
right.
filter. And what does my
Yeah.
filter tell me? So it's such a weird time and it still is. I mean, we're kind of coming out of it now. People are starting to get back, but they're still not there. I mean, there's still some hesitancy. I see it. I hear it
There's
from
a lot
clients.
of hesitation. So for example, in the entire story of the vaccine, um, so people need to understand that vaccines are not uh, they're not miracle drugs. When people there is always going to be a risk with every vaccine. There is a risk. People need to understand that, but nobody wants to talk about that. Like what they don't say is the risk of the vaccine is always much lower than the risk of the disease. But to go around saying that, hey, the vaccine does produce injury and therefore I'm not going to take a vaccine is not effective. At the same time, to go around saying the vaccines completely don't produce any injury is also not effective. So the casualty in this very black and white approach to medicine is that truth is the first victim here. The truth is that vaccines do protect, but when they protect by boosting your immune response to a molecule that is vital for that particular organism to survive. But when you do that, if that molecule is shared by portions in your own body, there is a small risk that your ability to attack that molecule your body may confuse your own body's molecule and attack it. So you can have vaccine-related injuries. Not all the time, not in every, for example, the mRNA vaccines have been given to millions of people right now, and the number of vaccine-related adverse effects are very, very small compared to what there are. But to go around saying that the vaccine kills is wrong, but to go around saying that the vaccine always protects is also wrong. And as long as people understand the risk and the benefit, then it's fair. In my clinic, we are open to our patients and say that there is always going to be some risk, and I want to see whether the protection from getting infected with a virus is more beneficial to you than not being protected. That's all.
And I think at the end of the day, that's really the approach it should be with any medication, right? Not just this, not here, but any medication. Uh, I've got a client right now that we were talking the other day, and she said, "Hey, I talked to my doctor, and he wants to put me on a statin for my cholesterol. I don't want to take a statin. I don't want to." And I asked him, "Well, what other options?" And he says, "Well, just Google up a new diet then." I said, "What?" I said, "Yeah." He told me just to go on Google and find me a low cholesterol diet. I said, "Well, baby, you need to find you a new doctor." I said, "If that was your doctor's answer is a statin or Google you a new diet, it's time to find a new doctor, because that's not that to me, that's not really doing a good job for your, why don't you, did I say, well, did he even ask you why you didn't want to take a statin?" It's like, no, it didn't ask me. But my mom, when she took it, had a terrible, terrible side effect from it. And I don't want to even take a chance.
So
I get
I
it.
give it.
No
I
questions.
give it.
It was a rushed appointment. She felt like she wasn't even being listened to. I mean, these are the things that people have to overcome with doctors now. But what you're talking about, I think, is just treating people the way they deserve to be treated. That's something, because of our crazy healthcare system the way we have, we've lost a little bit of that too. They don't get enough time with doctors to get that information out there.
The big problem is there is a saying called the physician's prayer, and there's a line in that saying, "Oh Lord, please save me from making the treatment of the disease more grievous than endurance of the same." so, so there is a lot to be said for managing the totality of the disease. See, patients, when they come to me, they're not coming because they have a diagnosis they're coming because they're saying, "Hey, doc, there's something in my life right now that is preventing me from enjoying life the way I used to. What can you do? And I do only three things. I either remove whatever it is that is preventing them from experiencing life the way they want to, or I try to reduce its impact, or if I can't do those two, then I try to teach them to live with it. That that's the only thing I do, and that's the only thing that doctors should be doing. Hey, I'll either make your cholesterol problem go away, or I'll try to reduce its impact, or I'll say, you know what, let's see how you can live life the best you can, even if the cholesterol is high. And that's all I can do. I can't. Uh, uh, my life cannot be about reducing cholesterol to an absolute zero number. That is not life. The purpose of why he came to you was what are the risks for heart attack and what are the risks for stroke, and you want to manage the totality of that. And cholesterol is just one aspect of that total body mentality. A bigger aspect is the inflammatory burden that he's carrying. And if let me tell you something about why cholesterol has become this big uh, bogeyman, because that's the only thing that they are able to measure. See, the reason why cholesterol is not a bad thing, the reason why cholesterol deposits on arteries is because arteries get inflamed when you have a high amount of inflammatory mediators in your body. So if you're eating a lot of sugar and a lot of other junk stuff in your diet, you are having low levels of antioxidants and other things. Those chemicals are circulating in your blood and it's causing injury to the lining of your blood vessels.
Yeah.
So remember what your grandma used to do when you used to have a burn? She would apply some Vaseline, right? What is Vaseline? It's nothing but grease. It's, it's fat. Or if you didn't have Vaseline, she would have applied lard, actually,
Lard.
which is pig fat. All right. For a burn. What is a burn except an inflammation and something that burnt your lining? So when your lining gets burnt, your blood vessel lining, your body applies lard to it. And what is the lard? It is the circulating cholesterol. But then this lard goes and lies on top of that portion of the blood vessel and builds up like so much sludge in your pipes. And it becomes a clot. It becomes a blockage. But the problem is not going around and saying, oh, I'm going to prevent lard from going around in your body because lard is useful for other parts of your body. The point is lower the inflammation. This is the reason why aspirin is so beneficial. And there are so many other ways to lower inflammation. There are healthy diets that lower inflammation. There are herbs and spices that lower inflammation. So these things can be incorporated into your diet and lower the total inflammatory burden. You can reduce your amount of processed carbohydrates. America is the world's #1 consumer of sugar. All right. Reduce the amount of sugar that you're consuming. Reduce the amount of processed flour that you are consuming. You know, those things, because these agents are high energy foods. And when you consume a high energy food and have a low energy life, that energy that you're consuming is going to burn you. And how is it going to burn you? It is going to burn you like this. It will go and injure your blood vessels. And then you will deposit lard on it to protect that lining. So, it's not about cholesterol that is important. It is actually how do you reduce your total inflammatory burden of your life? Inflammation is the price you and I pay for being alive. This is the cost we pay. We have to.
Wow, I'll tell you what, I've never had it explained to me quite that way. That was pretty good, Doc. I like that. I hope you folks out there listening got that because That's that's pretty cool. I really like the way that you explain the whole cholesterol thing and why some folks have that issue. That
That
was
is the
very cool.
reason why. That is the reason why you will have these stories of somebody who smoked till 90 and they actually had high cholesterol, but they never had a heart attack. What? How did that happen to that guy? Because he never burned his blood vessels in the first place.
Yeah,
So that doesn't mean it's good to smoke. That doesn't mean it's good to have high cholesterol. What I'm saying is the real linchpin of the entire cascade is inflammation.
it's
Cut
inflammation.
inflammation down.
Huh.
That's the
And there
foundation.
are. You're right. There's a lot of natural ways that you can do that. There's a lot of natural uh,
Yeah.
things out there. Lots of herbs, lots of different oils and things like that you can do to cut down. Lots of changes to
Yes.
your diet that can make that big difference on that inflammation. So that's great advice. That's great advice. Hey, I know we
Yeah.
went kind of crazy off onto other subjects here, guys, but I'll tell you what, it's been very, very interesting. All the things that you've had to say about across this spectrum. I know we went down that COVID rabbit hole again, and folks, if you haven't heard anything about COVID for a while, well, guess what? You got to hear it today. So I hope y'all enjoyed listening to a little insider information. And I am very interested in this book, guys. The Reaper's Dance: 1,000 Days of COVID, by, of course, Dr. Robert Iyer. So you can find that out at
Amazon.
Ravi Iyer,
Uh,
out at Amazon. I went and checked it out already to make sure you could find it out there. And sure enough, it's got some really nice reviews on it as well. So be sure and go and check that out. You can also go check out Dr. Iyer on his website. It is, surprisingly enough, driyer.com. So that's DRIYER.com. Who would have thought that, it would have been something quite that simple? There's lots of information about him. Also, of course, his biography, and then information about his book, and then a whole lot more information there as well. Man, I sure appreciate the time you have spent with us. I have a feeling that we could probably talk on multiple other subjects and probably sit here for the next 2 hours going through a number of things. The width of your knowledge here on so many different subjects is really amazing. So I really have appreciated having you on the show.
oh, it was such a pleasure talking to you, Harvey.
I've already got an idea for a potential part two for this thing. So I'm going to talk to you after this because I have some ideas that I think would be great for another show that would maybe take us in a different pathway, but with someone that has as much experience and knowledge as you have, I think it would be a fun to maybe hit on some other subjects as well.
I love that. Thank you.
All right, great. Hey, well, folks, thanks a lot for being with us today. Hope you enjoyed this episode of the Health and Wealth Power Hour. Don't forget, if you want to subscribe to the podcast, you can go out to hwpowerhour.com and subscribe right there, or just keep on listening to all of the regular places you digest your podcast on Apple, Spotify, Google, YouTube, wherever you want to go and listen to that. And remember that every last Tuesday of the month, you can join us on LinkedIn, 11 a.m. Central Time, last Tuesday every month for Why Does Healthcare Suck? That's right. Why Does Healthcare Suck? The ongoing sometimes it's a podcast as well, LinkedIn audio room that we dive into all the different parts of what's really going on in the healthcare industry and how you can avoid some of the things that are happening. We have had 2 consecutive dives into why employers are not more interested in jumping into the bandwagon of alternative funded health plans where they could really provide their employees better access to healthcare. Imagine that, putting healthcare into a health plan. We're going to keep going down that pathway for a couple more weeks as we have had employers that have done so asked to be on the show to talk about what their journey has looked like. So we're going to continue down that pathway for a few more weeks and see where we go from there. Also, don't forget, we have now restarted the Kickstart every Monday, 10 a.m. Central Time on LinkedIn as well, LinkedIn Live. It is going to be a live show that you can watch afterwards if you'd like to as well. We're going to keep you up with interesting news and trends every week, live 10 a.m. on Monday mornings. That's 10 a.m. Central Time. Appreciate you being here. Everyone have a super blessed week, and we'll catch you next time on the Health and Wealth Power Hour. We are out.